is Kelly Ogilvie. I'm an emergency room physician at Vancouver General Hospital, and I've also spent the last 3.5 years working at St. Paul's, as well as the MMU, the Mobile Medical Unit in the downtown east side, which opened up in the response to the significant opioid crisis, which was affecting Vancouver starting last summer. So fentanyl has really affected the overdoses that we've been seeing before. What's been happening with fentanyl is the rate of which folks have been overdosing is markedly higher. And so when they take a dose of their regular heroin, if it's laced with fentanyl, they have a significant effect of becoming essentially overdosing without really realizing that that was going to happen. The degree or the speed at which someone becomes unconscious and loses their breathing is much, much faster with fentanyl. So that's why the death rates have been so much higher, is there's a failure to be able to recognize they have a potential for overdosing. And when they do, they get sick much faster. Because there's lots of folks you hear a lot about that use in groups, or they use at Insight, which are the safe injection sites, but there are a great deal of people who are overdosing by themselves in their homes. And the problem with that is, even if they do have a Narcan kit, there is no one there to administer it to them, and there's no one that knows that they're in trouble. The problem is once someone has overdosed, they stop breathing, and which is a result of the fentanyl, that's how people are dying. You only have a very narrow window of about 5 to 6 minutes when that person stops breathing and before they start to have a cardiac arrest related to their lack of oxygen. And that time frame is very, very short.
The fentanyl crisis is not a problem limited to Vancouver. There have been 922 deaths due to illicit drug overdoses in British Columbia in the last year, and 116 this January alone. We were astounded to learn that 90% of these deaths occurred indoors, while 60% of the overdose incidents leading to death were not reported. Can an early community response to these incidents lower the rate of deaths and ease the burden on healthcare workers? How can technology be leveraged to facilitate this? The opioid overdose triad of signs and symptoms includes loss of consciousness, constricted pupils, and respiratory depression. We've chosen to focus on the detection of respiratory depression, as it is an early and reliable indicator of overdose. This is our proof of concept prototype. It uses a pulse oximetry sensor to measure breathing rate through heart rate variability, and an accelerometer to detect when the patient has become unconscious and has stopped moving. The green light indicates my current heart rate, the yellow light indicates motion, and the red light turns on when I've stopped moving for a period of 5 seconds. One of the biggest challenges facing the implementation of a solution like this would be patient compliance. Would patients be willing to wear this device? Would they be willing to charge it regularly? Would they wear the device all the time, or just when using drugs? User perception is another concern. We wouldn't want the device to be an indicator that the person is a drug user. Preferably, the packaging would look more like your usual fitness tracker. Currently, volunteer organizations like the Overdose Prevention Society patrol with naloxone kits. In a place like the downtown east side, a kit is never far away. Naloxone is an effective treatment that can roll back the effects of an overdose. Soliciting the help of bystanders through a distress signal would bring medical intervention to the overdoses that might otherwise go unnoticed, facilitating the delivery of treatment when timing is critical. This device would be complementary to the distribution of naloxone kits. Additionally, since it is a community-based response, it would carry less stigma than direct reporting to emergency services.
To overcome all these challenges that we've just mentioned, we will rely heavily on the insights and the vast experience of community partners to test the validity of our approach. The Overdose Prevention Society also runs pop-up safe injection sites, and they have expressed interest in using these sites to test the device in a controlled and supervised environment. We have also been in contact with medical professionals who have worked on the front lines and are interested in working with us to evaluate the utility of a technological approach to address the opioid crisis. And the design of this device will be iterated based on the data that we've collected and the feedback that we will receive from various stakeholders.